A very good evening to all. Let's start the session with Omkaram. Om, Om, Om. Let's now continue with the NMO mantram. Natvaham kamaye rajam, na swargam na punarbhavam, kamaye dukkatapnam, praninamurti nashanam. On behalf of NMO Andhra Pradesh, I extend a warm welcome to all the participants and respected faculty members to today's Yellapragada Subbarow Clinical Campus session. This initiative serves as a valuable academic platform that encourages clinical learning, critical thinking, and interactive discussions among students. Today, we have an interesting case presentation on anemia and pregnancy. The case will be presented by Ms. Devi from 2023 batch, Kurnool Medical College. We are privileged to have Dr. Pravallika Sudharani ma'am from Department of Obstetrics and Gynecology, who is an associate professor in SVIMS, as the moderator and faculty for today's session. Without any further delay, I request Ms. Devi to kindly take up the presentation.
A 23-year-old female named Meherin B, who is a housewife resident of Kurnool, educated up to 10th class. Her husband, Maulali, merchant by occupation, belonging to the family, lower middle class family, according to modified Kuppuswamy classification. She is a booked case at GGH Kurnool. Her obstetric score is gravida 2, para 1, live 1, with 31 weeks of gestation, ma'am. Her LMP is 24/11/2025, ma'am, and her EDD is 1/2026, ma'am. She was married 19 years to Maulali, ma'am. Non-consanguineous marriage, and her married life is 4 years, ma'am.
Yeah.
Weeks of gestation came for regular days ago and okay ma'am, sorry ma'am. Gravida 2, para 1, live 1 with 31 weeks of gestation, ma'am, came for regular antenatal checkup 3 days ago and was found to have low hemoglobin levels, ma'am. No complaints of pain, abdomen, bleeding or leaking PV, ma'am. No complaints of excessive fatigue, lethargy, breathlessness, palpitation, dizziness or syncope, ma'am. No complaints of excessive menstruation prior to pregnancy, ma'am. No complaints of vomiting blood, black colored stools, blood in urine or coughing of blood, ma'am. No complaints of fever, night sweatings, chronic illness or worm infestation, ma'am. No complaints of yellowish discoloration of skin or sclera, ma'am.
Okay.
Ma'am, coming to history of presenting illness, ma'am. Patient is apparently normal, ma'am. She came for regular antenatal checkup 3 days ago and was found to have low hemoglobin level, ma'am. Low hemoglobin levels, ma'am. No history of pain, abdomen, bleeding or leaking PV, ma'am. No history of menorrhagia prior to pregnancy. No history of excessive fatigue, lethargy, breathlessness, palpitation, dizziness or syncope, ma'am. No history of fever, night sweatings, chronic illness or worm infestation. No history of bleeding, hematemesis, melena, hematuria or hemoptysis, ma'am. No history of yellowish discoloration of skin or sclera, ma'am.
Okay.
Ma'am, history of present pregnancy, ma'am. She conceived spontaneously, ma'am. Pregnancy was confirmed after 2 months of amenorrhea by urine pregnancy test by herself, ma'am. First trimester, ma'am. No history of excessive vomiting, no history of morning sickness, no history of easy fatigability, shortness of breath, palpitations, lethargy, ma'am. No history of increased frequency and burning micturition, ma'am. No history of fever with rash, ma'am. No history of bleeding or leaking per vagina, ma'am. No history of pain abdomen. No history of exposure to radiation drug intake, ma'am. Uric acid tablets were taken immediately after pregnancy was confirmed, ma'am. Underwent blood test and dating scan was done at the 3rd month of gestation and was found to have normal and corresponding with gestation, ma'am. to second trimester, ma'am. Quickening felt at 5th month of gestation, ma'am. No history of excessive vomiting. History of fever with rash. No history of easy fatigability, shortness of breath, palpitations. No history of pedal edema, ma'am. No history of increased frequency and burning micturition, ma'am. No history of headache and blurring of vision, ma'am. No history of bleeding or leaking PV, ma'am. No history of any drug intake or radiation exposure, ma'am. TD vaccine first dose was taken 4th month of gestation, ma'am, and second dose at 6th month of gestation, ma'am. Iron folic acid tablets and calcium tablets were taken from 4th month of gestation, ma'am. Scan targeted imaging for fetal anomaly scan was done at 5th month of gestation. Urine albumin, blood pressure, oral glucose tolerance test were done and was found to be normal, ma'am. Coming to third trimester, ma'am, fetal movements were well pursued, ma'am. History of pedal edema which subsides after taking rest since 7th month of pregnancy, ma'am. No history of fever with rash, ma'am. No history of pain abdomen. No history of bleeding or leaking PV. No history of increased frequency or burning micturition. No history of headache, dizziness and blurring of vision, ma'am. Iron folic acid and calcium tablets were taken, ma'am. Ma'am?
Continue.
Yeah, thank you. Okay, ma'am. Underwent blood test and was found to have hemoglobin levels, ma'am. Growth scan was done at 31 weeks of gestation and was found cephalic presentation, ma'am. Ma'am?
Continue, Ra.
Okay, ma'am. On 3 years ago, full-term pregnancy, ma'am, by emergency lower segment C-section, ma'am, because of fetal distress due to meconium stained liquor at GGH Kurnool, ma'am. A healthy female with a weight of 27 kg, she cried immediately after birth, ma'am. Treated at NICU for 24 hours for observation, ma'am. Breastfeeding was initiated of 24 hours after birth, ma'am. Child is immunized till date. Milestone were achieved as per age, ma'am. Child is now 3 years old, active and going to Anganwadi, ma'am. I'm coming to menstrual history and marital history, ma'am. Menstrual history, ma'am. Her LMP is 24/11/2025, ma'am. Her EDD is 19/2026, ma'am. She attained her menarche at the age of 14 years, ma'am. She has regular cycle, 28 to 30 days cycle, ma'am, with 5 days flow, changing 3 pads per day, ma'am. No history of passage of clots, ma'am, and the menstruation is associated with dysmenorrhea, ma'am. To marital history, ma'am. She was married at the age of 19 years to Maulali, ma'am. A marriage is non-consanguineous marriage, ma'am. Her married life is 4 years, ma'am. No contraceptives were used before first and second pregnancies, ma'am. Past obstetric history, her past history was, ma'am, past medical history. No history of blood transfusions in the past, ma'am. No history of iron sucrose infusions. Not a known case of diabetes mellitus, hypertension, TB, asthma, epilepsy, coronary artery disease, chronic kidney disease, and thyroid, ma'am.
Nothing significant, no? Okay. Next.
Yes, ma'am. Past surgical history, ma'am.
Okay,
No
leave it. Next. So no family history.
Yes, ma'am.
Only mother is diabetic.
Yes, ma'am. Yes, ma'am. Her mother is diabetic. In the family, ma'am. No history of twinning. No history of chromosomal anomalies or birth defects in the family.
Next, personal is nothing. Next, general physical examination.
Yes, ma'am. Ma'am, consent was taken, coming to general physical examination, ma'am. Consent was taken for general physical examination, ma'am. Patient is conscious, coherent, cooperative, well-oriented to time, place, and person, ma'am. She is a obese stage 1 build, ma'am, with moderate nourishment, ma'am. Coming to general signs, ma'am. Pallor is present, ma'am. Icterus, cyanosis, clubbing, and generalized lymphadenopathy are absent, ma'am. Pedal edema is present, ma'am, which is bilateral and pitting type, ma'am. Coming to gait, ma'am, her gait is waddling gait, ma'am. Her height is 160 centimeters, ma'am, with the current weight of 91 kilograms, ma'am. 91 kilograms, ma'am. Her pre-pregnancy weight is 85 kilograms, ma'am. Her BMI is 35.5 kg per meter square, ma'am. Thyroid appears to be normal, ma'am. Thyroid appears to be normal, ma'am. Spine appears to be normal. Breasts are normal, ma'am. JVP is not raised, ma'am. Ma'am, coming to vitals, ma'am. Temperature is her temperature is 98.6 degrees Fahrenheit, ma'am. Blood pressure is 120 by 80 mmHg in right arm in sitting position, ma'am, which is measured in right arm in sitting position, ma'am. Her pulse rate is
vitals are normal. Next.
Yeah. Yes, ma'am.
TVS is okay. Next, per abdomen.
Yes, ma'am. Per abdomen examination, ma'am. Per abdomen examination was done dorsal supine position with semi-flexed thighs, ma'am. And the abdomen was exposed from xiphisternum to pubic symphysis, ma'am. Liver and spleen are non-palpable, ma'am. Into obstetric examination, it is also done in dorsal supine position, ma'am. Inspection, ma'am. Abdomen is distended, globular shaped, and skin over the abdomen is normal, ma'am. Umbilicus is normal and centrally located, ma'am. Linea nigra, linea albicans are present, ma'am. Stria gravidarum and fetal movements are present, ma'am. Coming to scar, ma'am. A horizontal scar is present at 2 finger breadth above pubic symphysis, ma'am. Size of the scar appears to be 12 centimeters, ma'am, which is healed by primary intention. There is no incisional hernia on cupping, ma'am, and hernial sites are intact, ma'am.
Okay.
On palpation, ma'am, the height of the uterus is 31 weeks of gestation, ma'am, and abdominal girth is 36 inches at the level of umbilicus, ma'am. Symphysia fundal height is 32 centimeters, ma'am. Coming to Leopold maneuvers, we have 4 maneuvers, ma'am. Fundal grip, umbilical grip, pollix grip, and pelvic grip, ma'am. Fundal grip, ma'am. A broad, soft, irregular mass, non-palatable, suggestive of breech, ma'am. Umbilical grip, ma'am. 2 lateral grips. Multiple knob-like structures suggestive of lymph buds on right side, ma'am. Uniform curved resistance on left side suggestive of spine, ma'am. Fetal movements were well pursued. Normal lichar and relaxed uterus, ma'am. Pollix grip or first pelvic grip, ma'am. Smooth, hard, palatable mass suggestive of head, ma'am. Coming to second pelvic grip, ma'am. Fingers converged, head is not engaged, ma'am.
Okay.
Percussion is not indicated, ma'am. Auscultation, ma'am. A fetal heart sound is heard at left spino-umbilical.
Diagnosis.
Fetal heart rate is 146 beats per minute.
What is your diagnosis?
Yes, ma'am. Ma'am, a 23-year-old Meherin B with obstetric score of Gravida 2, Para 1, Live 1 with 31 weeks of gestation, presents with moderate anemia, probably due to iron deficiency, ma'am, with no clinical signs of failure, ma'am.
Okay. Is she booked case?
Yes, ma'am, she is a booked case, ma'am.
What is mean by booked case?
At the first hospital, minimum 100 folic acid tablets should be taken, ma'am. And each and every trimester, she needs to have antenatal checkup.
Okay. Okay. With the, she is a previous cesarean section, no?
Yes.
First, what about her first delivery?
Ma'am?
What about her first delivery, first pregnancy? Is it normal delivery or cesarean section?
Emergency lower segment C-section, ma'am.
But in your diagnosis, you have not mentioned about the previous cesarean section. She is 23-year-old with
Ma'am,
the second
so-
child, a para one living one with 31 weeks with previous cesarean section with moderate anemia. Okay. Mm.
Yes, ma'am.
So she's 31 weeks. What is the causes of anemia in this case, in your case? What are the
It
causes?
is
Your voice is not clear. Your voice is not clear. Devi. Devi, no?
sorry for the inconvenience, ma'am. Ma'am, food diet, ma'am.
Can you go back to palpation? I mean, inspection, palpation slide.
Yeah, so
Abdomen examination, inspection, palpation slide. This is the inspection. No?
Yes.
No. Okay. Palpation slide. Okay. So you have not mentioned about scar tenderness, right? Regarding scar tenderness. Okay. What are the causes of anemia in your case?
is probably maybe probably food, ma'am. Ma'am,
Voice not at all clear.
food diet, ma'am.
Okay. One thing
Yes.
is she belongs to, what is her socioeconomic status?
Ma'am, lower middle class family.
Okay, because of her low socioeconomic status, also one of the reason, and poor intake. And then
It may be uh, ma'am,
tell me.
increased volume of body fluids, ma'am. It may be due to increased volume of body fluids, ma'am.
What is that called? What is that called? It is a hemodilution,
Hemodilution, ma'am.
hemodilution. Because of the hemodilution, normally pregnant women will have anemia. Okay.
Yes, ma'am.
So what do you want to do with this case? She's 31 weeks, no? With a moderate
Yes.
anemia. What is the grade of anemia? How do you grade the anemia?
Ma'am, by checking hemoglobin, ma'am, we can grade the anemia, ma'am. She is moderate weak, ma'am.
What are the sites for checking anemia? Look for
Ma'am, lower palpable conjunctiva, ma'am. We check for pallor, ma'am. In lower palpable conjunctiva, and the tip of the tongue, ma'am, nail beds, and the skin, ma'am. Skin
Skin.
Skin over the palm.
Palmar creases. Okay, నీ presentation finish అయిందా? Case presentation finished? ఇంకా slides ఉన్నాయా?
No, ma'am. All slides are completed, ma'am.
Okay. So now we can discuss the case కదా?
Yes, ma'am.
So 11 members ఉన్నారు. ఓకేనా?
Yes,
ఇంకెవరైనా
ma'am.
రావాలి? So now she is a 23-year-old, second gravida with moderate anemia with previous cesarean section. How do you manage this case?
Ma'am, I will give iron folic acid.
Now you said it's a moderate anemia, 31 weeks. You want to admit the case, or you want to admit or investigate the case, or simply you want to treat the case by giving only iron tablets?
I need to admit the case, ma'am.
Management means investigations and treatment. What are the investigations you want to do in this case?
We will do complete blood picture, ma'am. Blood grouping and RH typing, ma'am. And we will do urine analysis, ma'am. Blood group and cross matching, culture sensitivity test, ma'am. ECG also we will do, ma'am. Ma'am.
Complete blood picture, urine routine, then grouping typing, then
Blood grouping and RH typing, ma'am.
okay. Next,
Blood grouping and cross matching, ma'am. We will do culture sensitivity test also, ma'am.
okay.
Doctor, we will do fetal Doppler, ma'am.
First, finish it of the blood investigations. Any other blood investigations you want to do?
Ma'am, random blood sugar, ma'am. We will do random blood sugar, ma'am. Blood urea, the serum creatinine, ma'am.
Okay.
And we will do peripheral smear, ma'am.
What is the importance of peripheral smear?
Ma'am, we can, ma'am, we can
Know the type and degree of anemia.
Whether it is microcytic or macrocytic, we will do under. Ma'am?
For typing and degree, to know the type of anemia, and we can know the degree of anemia by doing peripheral smear, whether it is microcytic hypochromic or macrocytic hypochromic. Okay.
Yes, ma'am. We'll check for parasites also, ma'am.
Parasites, number of parasites.
Yes, ma'am.
Okay. In complete urine examination, what you will check?
Urine albumin and sugar levels, ma'am.
Okay.
And if any hematuria is present or not, we will also check for hematuria also, ma'am. First cells in the urine, ma'am.
That means urinary tract infections. Okay.
Yes, ma'am.
UTI, because of UTIs also can cause anemia. How? Chronic UTI can cause anemia.
Ma'am, due to chronic UTI, there is blood. There is excretion of blood in urine, ma'am, due to chronic UTI.
Okay.
Due to loss of blood, there will be anemia in chronic. Sorry, ma'am. Chronic urinary tract infections, ma'am.
No, that's okay. But for chronic urinary tract infections, kidney will be, renal involvement will be there. So kidney is the source of erythropoietin. Okay. So there will be decreased production of erythropoietin, which in turn cause anemia. Okay.
Yes, yes, ma'am.
This is in chronic kidney diseases, chronic UTIs. Okay.
Yes, ma'am.
Then any other investigations? Thyroid profile you want to do or not?
Ma'am,
Thyroid profile. You want to do thyroid profile or not?
yes, ma'am.
What is meant by growth scan?
Ma'am, it indicates the fetal growth, ma'am.
Mm.
And
When you will do growth scan?
in that trimester, we will do growth scan, ma'am.
After 32 weeks. Okay, at 32 weeks, we usually do the growth scan. What is the importance of growth scan? What you will see in the growth scan?
Ma'am, we will see fetal heart rate, ma'am, and weight of the fetus, ma'am, and we can see eye of the fetus, ma'am. Presentation of the fetus also, ma'am.
And then, apart from fetus, any other things?
We can also see placenta, ma'am. Position of the placenta, ma'am.
And can also see the liquor status. Okay, amniotic fluid.
Yes, ma'am.
And also the fetal Doppler. You can do fetal Doppler in the growth scan. Okay.
Yes, ma'am.
The baby is IUGR or not?
Yes, ma'am.
Any are present or not? We can check in growth scan along with fetal Doppler.
Yes, ma'am.
So we have done all the investigations. So moderate anemia means our HB will be around.
Ma'am, the hemoglobin will be around 8 to 9.9 grams per deciliter, ma'am.
According to WHO, what is the grading of anemia?
According to WHO. Sorry, ma'am, I forgot, ma'am.
Okay, mild, moderate, severe. Okay, three types. You go
Yes,
and
ma'am.
read that thing, grading of anemia. So in your case, you are telling it is moderate anemia. So what you want to do? You have investigated, you have done her HB is around 7. What you want to do? 7 point. She's 31 weeks. What you want to do? Your voice is not clear.
Is it audible now, ma'am? Is it audible now, ma'am?
Okay. Now it is audible.
Yes, ma'am. We will go for blood transfusions, ma'am, and we will go for parenteral iron therapy.
Why? You can go for oral preparations, no? Why?
In oral to increase the hemoglobin levels.
మీ వాయిస్ క్లారిటీగా లేదురా, కట్ వస్తుంది, బ్రేక్ అవుతుంది.
Sorry, ma'am.
So why not oral preparations? Why you want to go for parenteral preparations? Patient is HP 7.5 grams. Second gravida, 31 weeks. What is your main? Want to give parental iron therapy? వినిపిస్తుందా? వినిపిస్తుందా? సో ఓరల్ ఎందుకు ఇవ్వరు? వై పేరెంటల్? వై యూ వాంట్ టు చూస్ పేరెంటల్?
Sorry, ma'am. I don't know, ma'am.
No, she's 31 weeks kada. So 7.5 only HB. సో ఐరన్ ఇంప్రూవ్మెంట్ ఎప్పుడు ఉంటుంది? నువ్వు ఒక అనీమియా పేషెంట్ ట్రీట్ చేశారు. సో ఐరన్ ఇంప్రూవ్మెంట్ ఎన్ని డేస్ కి ఇంప్రూవ్మెంట్ ఉంటుంది?
Ma'am, after 2 weeks, ma'am, we can see reticulocytosis in blood, ma'am, and then after 4 weeks, there will be improvement of iron in the blood, ma'am.
ఎంత ఇంప్రూవ్ అవుతుంది? ఎన్ని గ్రామ్స్ పెరుగుతుంది?
Ma'am, 1 gram per week, ma'am.
1 gram per week. So parental preparations ఏంటివి? What are the parental preparations?
Ma'am, iron sucrose, ma'am.
Okay.
Iron sucrose, ma'am. And the carboxymaltose, ma'am.
Okay. How do you calculate the deficit, iron deficit? So you want to give iron sucrose, parental iron infusions. So how much you will give? What is that formula to calculate the iron deficit?
Ma'am, 2.4 in present hemoglobin levels into ma'am.
ఇంకా మధ్యలో ఏదో మిస్ చేశారు.
Plus 1000 milligrams for maintenance. Then, ma'am.
Don't want to add body weight. ఫార్ములా చెప్పండి కరెక్ట్ గా. ఫార్ములా ఉంటుంది కదా, వాట్ ఈస్ దట్ ఫార్ములా? సరే మళ్ళీ వెళ్ళి చదువుతారా? వినిపిస్తుందా? What is the formula to calculate the iron deficit?
సారీ టు ఇంటరప్ట్ మ్యామ్. దేవి, ఒకవేళ మీరు వీడియో ఆఫ్ చేసుకుంటే మీ వాయిస్ బెటర్ వస్తుంది అనుకుంటా.
ఓకే ఫైన్. దేవినా? దేవికా? నేనా?
మ్యామ్ దేవి మ్యామ్. అంటే తనది వాయిస్ కట్ అవుతుందని వీడియో ఆఫ్ చేసుకుంటే బెటర్ వస్తుందని చెప్పి. థ్యాంక్ యూ మ్యామ్.
Ma'am, is it audible now?
Audible, ma'am. It's audible.
Ma'am, 0.4 into targeted hemoglobin minus present hemoglobin into pregnancy weight, ma'am.
Plus
1000 milligrams, ma'am.
What is that formula name?
It is a Ganzoni formula.
Ganjoni's formula. That is called Ganjoni's formula. So,
Yes, ma'am.
So you want to give parenteral infusions. Okay. If what are the side effects, adverse effects of parenteral infusions?
Ma'am, anaphylactic reactions, ma'am, joint pains, and staining at injection site, ma'am.
No. What are the iron rich foods?
Liver meat.
Liver meat. Liver meat, then liver meat and
Liver meat, fish, green leafy vegetables, ma'am. Gooseberries and citrus fruits, ma'am. Dates and nuts, ma'am.
okay. So when you want to పేషెంట్ ని మళ్ళీ ఎప్పుడు రమ్మని చెప్తారు మీరు? 31 వీక్స్ అనిమియా కరెక్ట్ చేశారు. సో మళ్ళీ ఎప్పుడు విజిట్ చేయమని చెప్తారు నీ ఓపీడీకి?
మ్యామ్ ఆఫ్టర్ 1 month, మ్యామ్.
ఎంత? వై?
Ma'am, to check whether the hemoglobin is raised or not, ma'am.
31 వీక్స్ కదా, నువ్వు మళ్ళీ యాంటీనేటల్ చెకప్ ఎప్పుడు రమ్మంటారు? వెన్ యూ వాంట్ టు హ్యావ్ హర్ యాంటీనేటల్ విజిట్, నెక్స్ట్ యాంటీనేటల్ విజిట్? The minimum antenatal checkups period?
4 antenatal checkups, ma'am. At 32 weeks, I will మళ్ళీ రమ్మంటాను, ma'am.
సో 31 వీక్స్ కదా, మళ్ళీ ఎన్ని వీక్స్ కి రమ్మంటారు? ఎన్ని డేస్ కి రమ్మంటారు ఓపీకి?
4 weeks కి రమ్మంటాం, ma'am.
No, it's 2 weeks, every 2 weeks. Okay.
Yes, ma'am.
After 28 weeks, every 2 weeks. After 36 weeks, it's a weekly once. Okay.
Okay, ma'am.
Till 28 weeks, 4 weeks once. It is weekly once.
Yes, ma'am.
So 4 weeks ante pedda gap వస్తుంది. So you should ask the patient to come to your OPD after 2 weeks. So what are the complications of anemia during antenatal period?
Ma'am?
Complications of anemia in antenatal period.
Ma'am, feed edema, ma'am. Intrauterine growth restriction, ma'am.
Complications means maternal and fetal complications. So what are the maternal complications? What are the fetal complications?
Ma'am, maternal complications are fetal edema, ma'am. Increase the risk of UTIs, ma'am. Urine tract infections, ma'am.
Okay.
Yes, ma'am.
అంతేనా? రెండేనా?
Ma'am, I'm reminding, ma'am. Preeclampsia, ma'am. Ma'am, preeclampsia, ma'am, preterm labor, postpartum hemorrhage, ma'am, and purpureal sepsis, ma'am.
Okay. Antenatal, again, you have to maternal complications, you have to divide into antenatal, intranatal, and postnatal complications. Coming to antenatal complications,
Ma'am, coming to antenatal complications, pedal edema and preterm labor, ma'am, preeclampsia.
pedal edema is it's not a complication.
Yes, ma'am.
It's a symptom.
Yes, ma'am.
Yes, ma'am.
Preterm labor, ma'am, preeclampsia, ma'am.
Very good.
In fetal complication, ma'am.
Okay, in fetal complication,
Fetal growth restriction, ma'am. Low. Yes, ma'am. Low birth weight, ma'am. Preterm birth, ma'am. Fetal distress. Intrauterine fetal death, ma'am. Birth asphyxia, ma'am.
Okay.
Yes, ma'am.
What about PPH?
It is a postnatal. Sorry, ma'am.
PPH.
Ma'am, PPH is also present, ma'am, in postpartum complication, ma'am. Postpartum hemorrhage.
So how do you manage second stage of labor? Suppose patient is landed into labor. She is into second stage of labor with anemia. How do you manage? Telida? What are the stages of labor? What are the stages of labor?
Ma'am, 3 stages, ma'am.
It's not 3 stages, 4 stages of labor.
Okay, ma'am.
First stage is onset of labor pains to full dilatation of cervix. Second stage is full dilatation, delivery of the baby. Okay. Third stage is delivery of the placenta. Fourth stage is observation. Okay. So how do you manage in second stage of labor?
Ma'am, we will monitor maternal condition, ma'am, and fetal heart rate, ma'am. Check for normal routine.
So this is a case of anemia kada. So, it's previous normal delivery. So, this is previous cesarean section. Anyway, this patient will. She has to undergo cesarean section only. But suppose she is previous normal delivery with a moderate anemia. She's in second stage of labor. How do you manage? You want to cut short the second stage of labor or not? అర్థం కాలేదా? సరే, how do you manage active management of third stage of labor? Active management of third stage of labor.
Ma'am, we will give antibiotics, ma'am, to avoid purpura.
No. Active management of third stage of labor. ఏమి ఇస్తారు? Oxytocin, 10 units of oxytocin.
Ma'am. Yes, ma'am.
ఇంకా controlled contraction, injection of oxytocin, delayed cord
Yes, ma'am.
clamping, ఇంకా యూట్రైన్ మసాజ్. ఎందుకు చేస్తారు యాక్టివ్ మేనేజ్మెంట్ ఆఫ్ థర్డ్ స్టేజ్ ఆఫ్ లేబర్? ఎందుకు చేస్తారు యూట్రైన్ మసాజ్? ఇవన్నీ ఎందుకు చేయాలి? మీరు ఏ సెమిస్టర్? థర్డ్ ఇయరా, సెకండ్ ఇయరా, ఫైనల్ ఇయరా? దేవి మీరు ఏ సెమిస్టర్, ఏ ఇయర్?
థర్డ్ ఇయర్.
థర్డ్ ఇయర్. అయితే
థర్డ్ ఇయర్ మ్యామ్.
ఓకే ఓకే, అయితే చెప్పాలి. సో ఎందుకు మేనేజ్ చేయాలి, ఎందుకు యాక్టివ్ మేనేజ్మెంట్ చేయాలి థర్డ్ స్టేజ్ ఆఫ్ లేబర్ లో అంటే మెయిన్లీ టు ప్రివెంట్ పీపీహెచ్. ఓకే, పీపీహెచ్ పోస్ట్ పార్టమ్ హిమరేజ్ ని ప్రివెంట్ చేయడానికి. సో మీకు ఎస్పీఎం కంప్లీట్ అయి ఉంటుంది కదా, కమ్యూనిటీ మెడిసిన్ సబ్జెక్ట్.
ఎస్ మ్యామ్.
సో నేమ్స్ గవర్నమెంట్ ప్రోగ్రామ్స్ అసోసియేటెడ్ విత్ అనీమియా, అనీమియాకి రిలేటెడ్ గా గవర్నమెంట్ ప్రోగ్రామ్స్ ఏమున్నాయి?
మ్యామ్ అనీమియా. అనీమియా ముక్త భారత్ మ్యామ్.
వెరీ గుడ్. ఇంకా
ఆర్బిఎస్కే మ్యామ్, రాష్ట్రీయ బాల స్వాస్థ్య కార్యక్రమం మ్యామ్.
దాంట్లో కూడా అనీమియా ఉందా?
ఇన్ చిల్డ్రన్స్ కి అనీమియా టాబ్లెట్స్ ఇస్తారు మ్యామ్ అందులో కూడా.
నేషనల్ న్యూట్రిషనల్ అనీమియా ప్రివెంటివ్ ప్రోగ్రామ్ అది కూడా ఉంది. ఓకేనా? నేషనల్ న్యూట్రిషనల్ అనీమియా ప్రివెంట్ ప్రోగ్రామ్. ఓకే, అదొకటి. అనీమియా ముక్త భారత్ ఒకటి. ఇంకా కొన్ని ఉన్నాయి బట్ ఓకే, మెయిన్లీ రెండు. సో ఈమెకి ఏం చేస్తావు మళ్ళీ, అనీమియా కదా, అట్ ద టైమ్ ఆఫ్ డెలివరీ ఏం రెడీగా ఉండాలి?
మ్యామ్ బ్లడ్ గ్రూపింగ్ అండ్ క్రాస్ మ్యాచింగ్ చేసి బ్లడ్ ట్రాన్స్ఫ్యూషన్ కోసం రెడీగా ఉంచుకోవాలి మ్యామ్.
అట్ ద టైమ్ ఆఫ్ డెలివరీ. ఓకే,
ఎస్ మ్యామ్.
సపోజ్ ఈమె ప్రీవియస్ సిజేరియన్ సెక్షన్ 38 వీక్స్ వచ్చింది, నువ్వు నార్మల్ చేస్తావా, సిజేరియన్ సెక్షన్ చేస్తావా కేస్ ని?
Ma'am, depending on a scar thickness, we will go for C-section, ma'am. Trial of
what is mean by VPAC?
Ma'am, VPAC vaginal birth after C-section, ma'am.
Okay.
Vaginal, ma'am.
So ఐరన్ కాల్షియం ఎన్ని డేస్ ఇవ్వాలి?
Ma'am, from second trimester to second trimester, ma'am, and up to 6th.
ఎన్ని డేస్ ఇవ్వాలి? ఇప్పుడు షీ డెలివర్డ్, so she delivered a baby, so you want to continue to give iron or not?
Ma'am, continue. We will continue to give iron, ma'am.
ఎన్ని డేస్?
For up to 180 days, ma'am.
It's not 180 days, it's 100 days. Okay, 100 days ఇవ్వాలి అంటే ఆల్మోస్ట్ 3 months. ఓకే, ఐరన్ కాల్షియం 3 months కంటిన్యూ చేసుకోమని చెప్పాలి, అనీమియా ప్రొఫైలాక్సిస్ గా. ఓకే, ఇంకేమైనా చేస్తావా? బేబీకి ఏం కాంప్లికేషన్స్ వస్తాయి డెలివరీ అయిన తర్వాత? బేబీ ఎలా ఉండొచ్చు అనీమియా పేషెంట్ లో? You already said కదా IUGR. వినిపిస్తుందా? వినిపిస్తుందా? Is it audible? Okay. Thank you. Your voice is not at all clear. టక్ 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 వస్తుంది.
Yes, ma'am. Is it audible now?
Now it is audible. It's Manoj, right? Low weight baby. Yes, very good. IUGR baby, low birth weight.
Yes, ma'am. Low IUGR baby, ma'am. Low birth weight baby, ma'am. And preterm birth, ma'am. Fetal distress and birth asphyxia, ma'am.
Yes, yes. Very good.
Yes, ma'am.
Neonatal anemia. Very good. Yes, Pallavi, correct.
Stillbirth, ma'am. Ma'am. Stillbirth, ma'am.
Yes, okay, okay. Stillbirth. సో లేబర్ టైంలో మానిటరింగ్ ఎలా చేయాలి డ్యూరింగ్ లేబర్? లాస్ట్ అండ్ ఫైనల్ క్వశ్చన్. ఈ ఆస్ఫిక్సియా, బర్త్ ఆస్ఫిక్సియా, నెనేటల్ ఆస్ఫిక్సియా, ఇలాంటి ఫీటల్ డిస్ట్రెస్ ఇలాంటివి ఉంటే ఎలా ఐడెంటిఫై చేయొచ్చు డ్యూరింగ్ లేబర్? వాట్ ఈస్ మీన్ బై సిటీజీ?
Ma'am. Don't know, ma'am.
తెలీదా? ఓకే. కార్డియో టోకోగ్రామ్. ఓకే, అంటే ఎన్ఎస్టి అంటే ఎన్ఎస్టి పెడతారు. సో అందులో ఫీటల్ యాక్సిలరేషన్స్, డీజలరేషన్స్, ఫీటల్ హార్ట్ రేట్, యూట్రైన్ యాక్షన్, ఎవ్రీథింగ్ ఒక చార్ట్, ఇట్ లైక్ చార్ట్ అనమాట. ఎస్, కార్డియో టోకోగ్రామ్. సో ఇఫ్ there is good accelerations, beat to beat variability with good fetal heart rate, అంటే that is reactive NST. There is any decelerations, no beat to beat variability ఉంటే నాన్ రియాక్టివ్ ఎన్ఎస్టీ. నాన్ రియాక్టివ్ ఎన్ఎస్టీ వస్తుంది అంటే it indicates fetal distress. So in that case you have to take decision. సో సెక్షన్ తీసుకోవాలా లేదా లేకుంటే అవుట్లెట్ ఫోర్సెప్స్ చేసుకోవాలా, ఫాస్ట్గా డెలివరీ చేసుకోవాలా? సో నువ్వు డిసైడ్ చేసుకోవాలి. ఓకే, ఆ టైంలో. ఓకే, వెరీ గుడ్ ప్రెజెంటేషన్ దేవి. ఐ థింక్ టైం అప్ అనుకుంటా. సో ఎనీ డౌట్స్? సో యువర్ థర్డ్ ఇయర్ ఓన్లీ, నో? సో ఇంకా లాట్ ఆఫ్ టైం ఉంది. సో స్టడీ వెల్. ఇంకా మంచి మంచి డిస్కషన్స్ చేద్దాము ఫ్యూచర్లో. ఏమైనా డౌట్స్ ఉంటే అడగచ్చు. ఉన్నారా?
If anyone wants to communicate, chat box లో అయినా పెట్టచ్చు, లేకపోతే లైక్ ఏమన్నా మాట్లాడాలనుకుంటే chat box లో పెడితే అన్మ్యూట్ ఆప్షన్ చేయొచ్చు. ఎనీవన్ నా డౌట్స్ అంటే ప్లీజ్ డూ రెస్పాండ్.
So that's what we discussed about management, antenatal management, intranatal and postnatal management. Antenatal ga ela manage cheyali pregnancy with anemia. So ఏం అడ్వైస్ చేయాలి యాంటీనేటల్ గా ఓవరాల్ గా ప్రెగ్నెంట్ ఉమెన్ విత్ అనీమియా? సో యూ హ్యావ్ టు అడ్వైస్ హర్ గుడ్ డైట్, ఐరన్ రిచ్ డైట్ అలాంగ్ విత్ ఐరన్ సప్లిమెంటేషన్, ఐరన్ కాల్షియం సప్లిమెంటేషన్. ఓకే, పర్ డే రిక్వైర్మెంట్ ఆఫ్ కాల్షియం ఈజ్ అరౌండ్ 1000 grams. High protein diet, and iron requirement is 60 milligrams of elemental iron per day. And follow up, she should take proper follow-ups to her obstetrician. ఇంకా స్కాన్స్, గ్రోత్ స్కాన్, టీఫా స్కాన్, ఎర్లీ స్కాన్ ఇవన్నీ ప్రాపర్ గా ఉండాలి. అండ్ గుడ్ న్యూట్రిషన్ తీసుకోవాలి. Regularly taking iron tablets. Okay, she's taking iron tablets regularly, but still she has anemia. She's pale and she developed anemia. ఎందుకు మీరే చెప్పండి. What are the causes of iron deficiency anemia? Very good. What hookworms? Name some hookworms. Hookworms. Okay, good. So second trimester lo you can treat the hookworm infestations by giving albendazole 400 milligrams stat dose. Okay. So ఏం అడ్వైస్ చేయొచ్చు మీరే చెప్పాలి. యూజువల్లీ ప్రెగ్నెన్సీలో ఫిజియలాజికల్ అనీమియా అనేది డెవలప్ అవుతుంది బికాస్ ఆఫ్ ద హీమోడైల్యూషన్. For that only we advise the patient to take iron tablets, FA stimulation test. Okay, iron stimulation test. అదంత ఇంపార్టెంట్ కాదు బేసికల్లీ. Yeah, it can be B12. For that only we have to advise complete blood picture along with peripheral smear. In peripheral smear, we can know the type and degree of anemia, whether it is microcytic hypochromic or macrocytic hypochromic. Based on the type and degree of anemia, we have to treat the patient. It is iron deficiency or megaloblastic anemia or any other type of anemia. So in India, most of the women will have iron deficiency anemia. It is most common cause for anemia. So decreased food intake, decreased absorption, ఇంకా ఏమేమి కాజెస్ ఉంటాయి, గ్యాస్ట్రో ఇంటెస్టైనల్ డిసీజెస్ ఏమైనా ఉండొచ్చు. అండ్ ఇంటర్ ప్రెగ్నెన్సీ ఇంటర్వెల్ as Manoj Kumar said. So the gap period, what is her previous child birth age? If inter pregnancy interval is short, she may develop anemia in the next pregnancy. Okay, what is the blood loss during cesarean section? Yes, because of the interpregnancy, 1000 ml in cesarean section and 500 ml in normal vaginal delivery. Okay. There are so many causes for anemia. So అందుకే మనము C-section is 1 liter, normal delivery is 500 ml, and మనం frequent antenatal visits లో ఎవ్రీ విజిట్ అప్పుడు మనం హిమోగ్లోబిన్ అనేది ఫ్రీక్వెంట్ గా చెక్ చేస్తూ ఉండాలి. సో రొటీన్ గా కంప్లీట్ యూరినరీ ఎగ్జామినేషన్ అండ్ కంప్లీట్ బ్లడ్ పిక్చర్ అనేది రొటీన్ గా చేయాలి. అలాంగ్ విత్ డిప్సీ టెస్ట్ అంటే జెస్టేషనల్ డయాబెటీస్ మిలిటస్ కి స్క్రీనింగ్ టెస్ట్. ఓకే, జీడిఎం డెవలప్ అయిందా లేదా అని స్క్రీనింగ్ టెస్ట్ అలాంగ్ విత్ స్కాన్స్. ఓకే, she is taking iron tablets but not improving iron అంటే ఓరల్ టాబ్లెట్స్ కి ఇంటాలరెన్స్ వచ్చి ఉంటుంది. ఓకే, ఐరన్ అబ్జార్ప్షన్ డిఫెక్ట్స్ ఉంటాయి, జిఏ అబ్నార్మాలిటీస్, జిఏ డిఫెక్ట్స్, if suppose she is intolerant to oral iron tablets, ante we can shift her to parenteral. Okay, oral tablets absorption proper గా అవుతుందా లేదా ఎలా చెప్తారు? షీఈస్ టేకింగ్ తను చెప్తుంది, పేషెంట్ చెప్తుంది ఐరన్ టాబ్లెట్స్ డైలీ తీసుకుంటున్నానని. కానీ ఏం సిమ్టమ్స్ అడిగితే పేషెంట్ ఐరన్ టాబ్లెట్స్ అబ్జర్వ్ అవుతుందా లేదా అనేది తెలుస్తుంది. గుడ్ స్టూల్ కలర్ అండ్ ఫస్ట్ థింగ్ ఇస్ ఇంప్రూవ్మెంట్ ఆఫ్ సిమ్టమ్స్ అన్నమాట. పేషెంట్ ఫెటిగ్, వీక్నెస్, డిజినెస్, హెడేక్ ఇవన్నీ ఉంటాయి బికాస్ ఆఫ్ అనీమియా. సో పేషెంట్ కి ఫస్ట్ ఇంప్రూవ్మెంట్ ఆఫ్ సిమ్టమ్స్ అనేవి ఉంటాయి అన్నమాట. అంటే సిమ్టమ్స్ రిలీఫ్ అనేది ఫస్ట్ థింగ్, ఫ్యాటిక్ రిలీఫ్. ఎస్, వెరీ గుడ్. సో ఇవి ఉంటుంది. నెక్స్ట్ స్టూల్స్ కలర్ అనేది కొంచెం బ్లాక్ గా ఉంటుంది. అండ్ we can check her tablets కూడా, అంటే ఎంటీ టాబ్లెట్స్ ఉంటాయి కదా, సో అవి కూడా మనం చెక్ చేయాలి. సో ఇవన్నీ తీసుకుంటే ప్రాపర్ గా తీసుకుంటుందా లేదా అనేది మనం చెక్ చేయొచ్చు. అలాంగ్ విత్ ఫోలిక్ యాసిడ్. వాట్ ఈస్ ద డోస్ ఆఫ్ ఫోలిక్ యాసిడ్?
500 micrograms OD, ma'am.
సో ఐరన్ అబ్జార్ప్షన్ ఇంక్రీజ్ చేసే థింగ్స్ ఏంటి?
Ma'am, ascorbic acid, ma'am.
అందుకని మనం పేషెంట్ కి ఏం అడ్వైస్ చేయాలి? షీ టేక్ ఐరన్ టాబ్లెట్స్ విత్ 1 glass of లెమన్ వాటర్ అన్నమాట. ఓకే, ఎర్లీ మార్నింగ్ ఒక గ్లాస్ ఆఫ్ లెమన్ వాటర్ తో ఐరన్ తీసుకోండి, ఐరన్ టాబ్లెట్ తీసుకోండి అని చెప్తాం అనమాట. సో కాల్షియం ఎప్పుడు తీసుకోవాలి? అట్లీస్ట్ ఐరన్ టాబ్లెట్ కి కాల్షియం టాబ్లెట్ కి షుడ్ గివ్ 2 hours గ్యాప్. బికాస్ ఐరన్ ని అబ్జార్ప్షన్ ని డిక్రీజ్ చేసే ఫ్యాక్టర్స్ ఏంటి?
Phytates, tannates, ma'am. Calcium carbonates.
Phytates, tannates. So ask the patient not to take tea, coffee immediately after taking iron tablets అన్నమాట. So avoid tea, coffee and calcium కూడా at least 2 hours గ్యాప్ తో తీసుకోవాలి. So these are the precautions she should take while taking iron tablets. Okay. Any doubts ఇంకా? ఈ డిస్కషన్ ఏమన్నా యూస్ఫుల్ ఉన్నిందా? అస్సలు లేదా? అర్థమైందా లేదా?
అర్థమైంది మ్యామ్. Ma'am, thank you so much, ma'am, for this is my first case presentation, ma'am.
Okay, you presented very well, but you missed some points. She's previous cesarean section kada, so అది మెన్షన్ చేయలేదు. అండ్ ప్రీవియస్ సెక్షన్ కాబట్టి స్కార్ టెండర్నెస్ కూడా నువ్వు చెప్పాలి, whether scar tenderness is there or not. If it is not there, we can mention there is no scar tenderness. That is one point. And you can also check the liquor status in palpation. Okay, whether liquor is adequate or not, or more than adequate anesi. ఓకే, టైం అయిపోయింది అనుకుంటా. Can we conclude the class now?
Yeah, ma'am. So as we come to the end of today's Yellapragada Subbarow clinical campus session, I would like to express my sincere gratitude to everyone who made this session meaningful and enriching. First and foremost, I extend our heartfelt thanks to Dr. Pravallika ma'am for graciously sparing her time with us today. I would also like to appreciate Ms. Devi from 2023 batch, Kurnool Medical College, for her well-prepared and informative presentation. My sincere thanks to all the participants for their enthusiastic presence and active involvement. I thank the entire NMO Andhra Pradesh team for their continuous efforts in organizing such active academic platforms. Let us conclude today's session with Shanti Mantram. Sarve bhavantu sukhinah सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ॐ शान्ति शान्ति शान्तिः थैंक यू ऑल धन्यवाद